We're on the Seahawks practice field for a discussion about how to keep your heart healthy and why that's so important. Joining me now is Dr. Justin Penn, a board-certified cardiologist who specializes in the prevention, diagnosis, and treatment of heart diseases. Thank you so much for being here.
Thank you for having me. Appreciate it.
Oh my gosh. So regardless of a person's age or fitness level, why should we all be prioritizing our heart health?
Such a great question. So heart disease kills more of us than any other disease. And even in women, believe it or not, heart disease kills more women than breast cancer. So it's extremely prevalent and so important. That's one of the reasons that it's so important for us to be really conscientious about our heart health.
Definitely. And how do our daily habits impact our heart health?
I think of like four major pillars of our life. So we think about exercise, sleep, nutrition, and our emotional health. So that would include like stress and stress reduction. And so each one of those has a huge impact on our heart health. Exercise, so important. Nutrition, so important. And then thinking about things like stress reduction, our emotional health, depression, anxiety, they all roll together. And the prevention and treatment of heart disease, you really want to focus on all those aspects of our health in order to really prevent and treat heart disease.
I wouldn't have thought sleep, but that all makes sense. Like, is there a certain amount of hours each night that we should be getting?
Ideally 8 hours of sleep, plus or minus one, so 7 to 9 hours of sleep. But it also is really important to think about the quality of the sleep that you're getting, because if you're not getting good quality sleep, it's really for naught. So we really want to think about not only duration, but the quality of the sleep. Yeah.
Those are all such great tidbits. And you also have some small lifestyle changes that we could all be thinking about to improve our heart health. So starting with number one, beverage swap. What do you mean by this?
Yeah, right. So we think about things like sugar drinks, like soda pop.
Okay.
So soda and other really sugary drinks really have a deleterious effects on our heart health, specifically because when you drink a really sugary drink, it's really going to increase our blood sugar levels and then our insulin levels. And then oftentimes what will happen, say 30 minutes to 2 hours later, is that we'll have a big crash. And we'll end up feeling really crummy afterward.
Yes.
Also, leads to things like weight gain, right? Because a lot of those sugary drinks are really devoid of nutrition. There's a lot of empty calories in there. And when you're consuming a lot of sugary drinks and empty calories, you're not getting a lot of fiber or other nutrients in there. We end up drinking more of those calories, it adds on a lot of weight, and so we end up with an obesity and diabetes epidemic that we're facing in this country. And so staying away from those sugary drinks can make us feel a whole lot better. And so if we're going to think about a swap anything out for a sugary drink. So think about a diet soda, think about just sparkling water, think about water with a little bit of an infusion in it, maybe some cucumber water or lemon water.
Anything that would be good.
Yeah, anything to get rid of those extra calories.
And snack swap, what do you mean by that too? Again, fiber, I'm assuming, is important.
And fiber, and then if you think about all the highly processed foods that we eat from snacks, there are so many things that we want to avoid there. Those highly processed foods have tons of salt, tons of sugar, and tons of fats that we just don't need. We want to really focus on eating whole foods. Whole foods are so much more nutritious. They have vitamins, polyphenols, fibers that are so good for our gut health, but then our heart health as well.
And getting some exercise in there, what do you mean by that specifically?
So we want to take advantage of our entire 24-hour day, right? 8 hours, we're going to be sleeping, so we're left with 16 hours. What are we going to do with that time? We want to ultimately have all of our patients exercising for as much as 240 minutes a week. That's a lot.
Yeah.
But that would be ideal, and a lot of us don't have that kind of time. So what can we do instead? We just want to have sedentary people start making small steps to increase their activity level. It could be as simple as 10 minutes at a time. What I love to see is after lunch, after dinner, just go out for a 5-minute walk, a 10-minute walk, go take the stairs, do something just to get your body moving. That will help with your metabolism. It'll add those exercise minutes that are so important, and therefore it'll all be really good for your heart in the end.
Yeah, those little changes, like you said, really go a long way. Cooking swaps. What do you mean with this? What should I be doing in the kitchen differently?
Well, we always want to think about first dietary patterns, right? So there is so much information coming at us from social media on what to eat and what not to eat. So what are some good overlying thoughts? Number one, Mediterranean diet or the DASH diet are two great methods of eating. Second thing, we want to really be careful about how we're cooking or preparing our meals as well. So I really encourage people not to fry their food, like deep fat frying adds a lot of extra calories and brings a lot of unhealthy fats into our diet. Thinking about fats in a healthy fats, what we really want to be cautious of is the difference between really healthy fats and unhealthy fats. So healthy fats would be such as olive oil, the fat that's in salmon, the fat that's in avocados or nuts. Those are all really healthy for us. But a lot of the fats that are artificial fats, so those would be highly processed fats or trans fats, very dangerous to our heart. And then we also have things like saturated fats, which would be like butter or any other fat that would be solid at room temperature. And that's a good rule of thumb to go by.
And your last tip was screen time.
Yeah.
So for all of us on our phones too long.
Right. We have to figure out some way to break that addiction to our screens. It's almost impossible. But a couple of thoughts would be, number one, instead of at the end of the day or just before bed, just hopping on your screen and just doom scrolling as you go through your news feed, take a break. Give yourself time for your brain to reset itself, relax. Do something that's much more helpful for your emotional health, like take a warm bath or go out for an evening walk, play a game with your kids. Any of those activities are going to be so much more rewarding for you in the long term.
Wow, this was so amazing and so insightful. To learn more about heart health or to find a provider, visit the website right there on your screen, vmfh.org/heart.
This special presentation of New Day Northwest, sponsored by Virginia Mason Franciscan Health.